After spending nearly 5 days in this Fredericton ER with pneumonia, Tim Brooks told CBC News he saw patients stuck in hallways and soaked in their own urine. But he doesn't blame the hospital staff.
Everybody was at their breaking point. You knew that they couldn't do anymore, and you knew that they weren't doing what they wanted to be able to do.
The survey confirms that
in Ontario, new numbers back that up.
This sense of hopelessness and despair is driving workers away.
A union representing the province's hospital workers is calling for an injection of provincial funding. It commissioned a survey in which 3% of its members responded. Close to a third of those respondents have thought about leaving their jobs, while 4 in 10 respondents said they dread going to work.
Many of our members have told us one of the reasons that they left is because of the crushing workloads that they have every single day.
If nurses are feeling and expressing that they are burnt out and tired and want to leave the profession, that doesn't surprise me at all.
This Toronto nurse says she's considered quitting herself.
A lot of things that are driving people away are, no one's really listening to our voiced concerns.
Ontario's Ministry of Health says plenty of nurses are being hired and they're among the highest paid in the country, while an independent analysis expects the province will still be short 33,000 nurses and personal support workers within just the next 4 years.
It's not rocket science. It's just a matter of focusing on retention strategies.
Research shows the problems go beyond any one province or profession. One study published last month found roughly 16% of Canadian nurses surveyed during the pandemic wanted to quit their jobs within the next 2 years.
Our solutions need to be multifaceted, but they also need to include the diverse range of professions.
So, Lauren, the big question is, how do we solve the situation in Canadian hospitals?
Well, Ian, there are plenty of solutions being tossed around. We keep hearing the provinces desperately need to train and hire more primary care providers, like family doctors, to keep people from relying on ERs in the first place. We need more spots in long-term care and hospice care, so people who need that specific level of care, often close to the end of their life, can get it, rather than taking up hospital beds when that's not exactly where they should be. And of course, we need better staff retention within hospitals themselves. Now, Ian, the situation could obviously get worse as our population ages, and none of this information is new. So now it's on governments to act.
Lauren Pelly in our Toronto newsroom.